Good morning, everyone. We'll start today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and Metro Coronavirus Task Force. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Nashville's Public Health Director, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Since yesterday morning, Nashville has had 3 more fatalities related to the coronavirus disease. And on behalf of all Nashvillians, I extend our deepest condolences to their families and friends as they grieve for the loss of their loved ones. Flattening the curve of the coronavirus disease requires a unified effort throughout our community, which is why the Metro Police and the Public Health Department continue patrolling and investigating residents' complaints to ensure county-wide compliance with the Safer at Home order. I want to remind everyone that you can report a suspected violation of the Safer at Home order by dialing 311 from anywhere within Davidson County and visiting hub.nashville.gov or downloading the Hub Nashville app. Now, to all Davidson County residents, please continue to follow the Safer at Home order by remaining at home, leaving only for essential errands. Your efforts are making a world of difference and will save lives. Now, this morning, I would like to thank our city's frontline healthcare workers, including our nurses, doctors, advanced practice providers, pharmacists, technicians, and support staff, who are working diligently to provide care to our community at this challenging time. Now, while working long, arduous hours, these everyday heroes are putting their patients first, providing comforting, life-saving care to our family, friends, and neighbors as our city confronts this historic challenge. The courage and personal sacrifices of Nashville's frontline healthcare workers will not be forgotten. Yesterday, I encouraged all of you to visit covid19.nashville.gov to learn how to fashion everyday household items into protective face coverings. And I urge everyone to wear such a mask in public settings where other social distancing measures are difficult to maintain, such as grocery stores and pharmacies, as the CDC recommends. And as Dr. Hildreth mentioned, these masks are not a replacement for safe social distancing. They are meant to add an extra layer of protective clothing for yourself and for others while outside the home. And you can donate homemade masks to the Community Resource Center at 218 Omohundro Place, Monday through Friday, 9 a.m. to 3:30 p.m. Your donated masks will be distributed to essential personnel who are not healthcare workers or first responders, but who are nonetheless part of Nashville's citywide COVID-19 response to continue delivering critical services to Davidson County residents. Anyone interested in learning how to make or donate homemade masks can visit covid19.nashville.gov. Now, this morning, I'm pleased to announce that the deadline to apply for Metro's tax relief and tax freeze programs has been further extended from May 6th to July the 1st, 2020. And once again, I'm grateful to Trustee Parker Toller for working closely with the state and our office to provide these tax relief deadline extensions for residents who are facing hardships during these difficult times. To learn more about the tax relief and tax freeze programs, visit nashville.gov/trustee or call 615-862-6330. And as always, you can visit the covid19.nashville.gov to make a contribution to the COVID-19 Response Fund, which has been established to provide relief to Nashvillians who are facing hardships, or to find information in obtaining financial, food, mental health, and social services assistance. And now I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning. Here's the latest information on the COVID-19 virus in our city. We now have a total of 1,075 confirmed cases. Yesterday, as the mayor had said, we had 3 deaths, a 62-year-old gentleman, a 72-year-old gentleman, and a 78-year-old gentleman. This brings our total number of COVID-19 fatalities in Nashville to 9. I would also like to express my condolences to these gentlemen's families and friends. We had an increase of 41 cases in the past 24 hours. Additionally, 1,045 confirmed cases are in our surrounding counties. This means there are over 2,100 cases of COVID in our immediate area. Of these cases, there are still a total of 51 COVID-positive patients in Nashville hospitals. Of the 1,075 Davidson County cases, 897 individuals are self-isolating at home and have manageable symptoms. 133 people have recovered and are cleared. This morning, I want to show you some data about the cases in Davidson County. This is a map that we will be updating once a week. This map shows the total confirmed COVID-19 cases that have been reported to the Metro Health Department up until April 6th. This heat map is based on zip codes and do not represent actual addresses or exact locations of cases. They are data points to represent the magnitude of this virus throughout our city. This shows where the person who tested positive lives and not necessarily where they contracted the virus. You will see the virus is more prevalent in some areas, and this is traced back to several incidents of groups gathering. Another takeaway is that there are cases all over our city. Also, you may note that we located our 3 assessment centers in areas of the city that have a higher incidence of disease in order to ensure that our residents have access to free assessments and testing if indicated. In regards to our assessment centers, this is the second week that our centers have been open. This is part of our larger community assessment system, which increases our capability to screen more residents and conduct more COVID-19 tests. Yesterday, 287 people were screened and 183 were tested. Additionally, more than 380 individuals called our hotline to get information and be referred. If you think you have symptoms, the first thing to do is call the assessment hotline at 615-862-7777. This hotline is open 7 days a week from 7 a.m. to 7 p.m. You will be connected to a medical personnel who will determine if your symptoms warrant further assessment. And if indicated, they will refer you to a healthcare provider or to one of our community assessment centers. As a reminder, our centers are open Monday, Wednesday, Fridays from 9 a.m. to 3 p.m. Finally, the 3 deaths yesterday and the data we share daily underscores that we really are on the upward part of our curve. We must stay vigilant and stay the course. If you decide not to follow the safer at home order, you are putting yourself and others at risk. Even if you don't feel sick, you may be carrying this virus and you can spread it to others. So think before you step outside your house and really evaluate whether the trip you're about to make is truly essential or not. And also, is there a way you can make less frequent essential trips? And return home once this is over. Social distancing and staying at home are truly the best weapons to fight this virus. We all must do it, and remember, we must all do it together to be successful. Tell your friends and family to stay home. Spread the word, not the virus. Thank you so much for your attention, and I'll look forward to questions.
At this time, we'd like to share a special message from a number of Nashville artists representing many different genres of music and entertainment with everyone across Nashville and Davidson County.
In Music City and across the country,
these are uncertain times.
Families are worried. Some are hurting.
But Nashville is strong.
America is strong.
We can all do our part to keep everyone safe.
Use precaution.
Wash your hands.
Stay away from crowds.
Help us flatten the curve.
Though we are apart,
we are
all in this together.
Stay safe, Nashville.
Thank you to everyone who brought us those important reminders, and to the Nashville Convention and Visitors Corporation for making it possible. We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Stephen Elliott with the Nashville Scene and Nashville Post.
Thank you. Do you think it's important to collect and report racial and other demographic data as well?
Thanks, Stephen. Dr. Jahangir.
Thank you so much. Currently, that data is not collected as part of the testing. There's really no specific reason to collect that data. Now, as I also am aware, and I know Dr. Caldwell and others are aware of other cities where hospitalizations and mortality regarding race may show disparity in healthcare. And I want to say that data we're working to collect and as appropriate will indicate, because we want to make sure all our residents get appropriate care, and that if there's any obvious disparities, we can address them. But regarding testing, that is not a variable that is currently collected. Thank you.
Ian Jong at the Tennessean.
Thanks. I just wanted to kind of follow up on that previous question. Can you clarify if that's just not a question that's asked on any of the forms during testing? And I mean, I guess if that data is collected, I mean, can that be shared publicly nonetheless on the website along with the other data that's been collected so far?
Dr. Jahangir.
Yeah, to my knowledge, that's not information that's collected when we or frankly any of the other places that test. That's not race is not a place area you collect that information. Excuse me.
Tosin Fakile, News 4.
Good morning. I think the heating maps is really cool. I had two questions. With the heating maps, do you guys know exactly why some areas are more red than the other? Like what's causing more places to be more prevalent? And my second question is, for the people who got tested at the assessment centers last week, have they gotten their test back? And is that included in the number Dr. Jahangir gives at the top of when he starts speaking?
Dr. Jahangir.
Thanks so much. So I'll take your first question first, or excuse me, your second part of your question is, yes, those results have been reported back to us, and those numbers that I provided include the assessment center numbers. Regarding the heat map that we showed, that heat map is all the cases in Davidson County, and in generalities, because can't get specific over specific events, but in generality, some of the heat spots you see are around certain large gatherings that occurred over the past month. If you look around the nation, some of those large gatherings may include religious events, maybe school events, maybe fundraisers, maybe large family meals, just speaking kind of in broad things. We cannot provide the specific events due to HIPAA reasons, but I do. But I think it is important to recognize that those large clusters you see are, in our experience, have been large clusters or surrounding certain events. So thank you.
Harriet Wallace, Fox 17.
Yes, good morning. I do have two questions. One goes back to reference the collection of racial data with related to the virus. Dr. Jahangir, I know you mentioned at this time for testing is not collected, but at what point will we see that data being collected? And also, what about those who currently are hospitalized or have died? Because as we know, this is a virus that goes beyond a number of demographic lines. However, all of that information can help to inform the treatment and care, and also flattening the curve, as you all mentioned, because a lot of societal things come with the different demographics, such as access to health care. My second question is, as we continue to see people violating the safer at home order, is there any plan to enhance enforcement from the law enforcement perspective? Thank you.
Thank you, Harriet. So the first part of the question is about racial data collection. The second part is about enforcement of the Safer at Home order.
Good morning. Dr. Jahanger is correct that when we receive the data from the lab testing, the racial data is not included typically. However, every time we get a positive test, we do an outbreak investigation and we ask some more detailed questions. Those data are not readily available at this time, but we are interested in it, and when the data is appropriately collected, we will share that with you. As for the enforcement issue with the Safer at Home order, could you please repeat your second question so I have it correctly?
Yes, thank you. My question is, as we continue to see people violate the Safer at Home order, is there any plan to enhance enforcement from a law enforcement perspective to ensure that non-essential businesses remain closed and that people do as they've been instructed to flatten the curve?
Well, I can tell you that we're going to have a measured approach, and that's what we're doing with our partnership with the police. And yes, if after we've asked somebody to close and they've closed, and then we go back and we see maybe they've changed their mind and are choosing not to comply, we will appropriately step up our enforcement in a very measured way, and we're going to continue to do that. So, thank you.
Nancy Amons.
Hi, thanks for taking my call. I have a couple of questions. Are you thinking that the peak time is changing for Nashville now? And also, I'd love to hear more about your heat map. And I know you said you're not tracking it to specific events, but perhaps you'd like to talk more about what the heat map shows.
Nancy, I apologize. Can you repeat the first part of your question as well? I also had a momentary. Peak time. Thank you. The mayor got it. Thank you, sir. You know, there are several models out there. I think the big model everyone follows is the IHME model. I think it's the White House talks about that, and it's out of Washington. You know, yesterday that model showed that Tennessee is doing better, and I'm happy to hear that. I'm cautious that I think 1 point is not necessarily the best way to approach this, although I do think our efforts to flatten the curve have helped. There are several other models that I know several of the health systems are doing, which shows that still we are on the upward trend, and the peak will probably happen in our region probably in about 2 to 3 weeks. Obviously, those models are also being updated. I'm actually speaking to a couple of those people who create those models later today. Hopefully I have better information for you around that. But I still believe that we are on the uptrend. I still believe the next 2 to 3 weeks will be most tough for our city. But I do think that we have hopefully flattened the curve some, and so it may not be as bad as we've been saying. But stay the course. That's my take-home message here. We can reverse all of our good work by just forgetting about it. Now, regarding the heat maps, again, I think what I'd like to share is kind of what I said earlier, is those clusters you see are around certain events that have occurred previously around, and again, I can't get into the exact specific event, but again, think about what's happened nationally. We've seen religious events, school events, fundraisers, big family gatherings. Those are consistent with what our clusters and Nashville have been thus far. So thank you.
Nayeli Alamia with 96.7.
Hi, thank you so much for taking my question. It's basically the same questions that have been asked earlier about racial demographics, because we're particularly interested in the Latino community.
Dr. Jungier?
Sure, thank you so much for bringing that up. We're concerned about all our residents as well in our city. We are following those trends, as Dr. Caldwell said. When there are positive results, we are following those and identifying clusters, and if they are of a certain group of people, we'll look into that. I will tell you, I want to reiterate this point. Our assessment centers in our community are open to all residents, irrespective of ability to pay, irrespective of how they are living in our city as far as immigration status, and we have multiple language abilities at these centers, so from Arabic, Spanish, so forth. So I encourage anyone that is worried about the symptoms, cough, fever, or shortness of breath, to go to a facility, get assessed, and let us make sure we have a clear understanding of what's going on in our community. So I just wanted to highlight that, and we're following all those trends as well. Thank you.
Our final question is from Kara Hartnett. Kara?
Hi, thanks for taking my question. Do you have an update on antibody testing? And if so, will we need that prior to lifting the safer at home order?
The question is about antibody testing. Dr. Caldwell?
Antibody testing is something that researchers are working on. It is not being done right now in Davidson County. We will have to learn more about how any research and antibody testing may apply for us stepping back the safer at home order. But for right now, we don't have more details on that, but we're very, very interested in it. Thank you.
There are no more media questions in the queue at this time. A recording of this press briefing will be made available later this morning. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.